All right, today we're going to peel back the curtain on a really critical but, almost invisible part of our healthcare system, the world of medical coding. I mean, really think about this for a second. You've got this whole team, surgeons, anesthesiologists, nurses, all moving like a well-oiled machine. It's this incredible moment of human skill and high-stakes medicine. And somehow, all that work, every single diagnosis, every tool they used, it all gets boiled down to just a couple of lines on an insurance claim. So how does that happen? Well, the answer is a very, very specialized skill. This amazing act of translation, it's all done by certified professional coders, or CPCs. These are the folks who speak what is basically healthcare's secret language. And they have to pass this notoriously tough exam just to prove they're fluent enough for the job. So how do they actually do it? Let's break it down. First, we'll talk about this secret language. Then, we'll see how coders have to decode the human body itself and get through these super complex rulebooks. After that, we'll see them in action as detectives. And finally, we'll get into why all these codes matter so much.
Okay, so to translate what happens in a hospital into code, you first have to understand what's happening, right? You have to speak the language of medicine. And that means coders need this incredibly deep, practical knowledge of the human body.
In fact, let's do a little pop quiz straight from the CPC certification exam. We'll start with an easy one. What's the medical term for the collarbone? You got it? Is it the patella, the tibia, the scapula, or the clavicle? The answer, of course, is the clavicle. But here's the thing. Knowing that, that's just the price of admission. That's the absolute bare minimum. It's kind of like learning your ABCs before you try to write a novel. Because it's not just about naming parts, it's about knowing what doctors do to those parts. So look at this other question from the exam. What's a salpingectomy? It's the surgical removal of the fallopian tube. A coder has to have thousands of these terms locked in their brain. And from there, the complexity just skyrockets. A coder isn't dealing with one thing at a time. No way. They're looking at patients like this one from the exam, a 62-year-old in the ICU with fluid overload, acute renal failure, sepsis, and pre-existing diabetes who's also sedated and on a ventilator. A coder has to untangle all of that because if they get it wrong, the consequences can be huge. Okay, so you know all the medical terms. Great, but that's only half the battle. Now you have to learn the language of the codes themselves with all of their own weird rules. See, coders don't just memorize these codes. They use these massive, dense manuals that are packed with codes for basically every diagnosis, procedure, and medical supply you can possibly imagine. These books are their dictionaries and their grammar guides. And get this, these manuals have their own special punctuation that a coder has to interpret perfectly. For instance, a little bullet point means the code's description has changed. A hash symbol means it's an add-on code you can only use with another specific code. A hyphen shows there's a whole range of codes to pick from. If you get one symbol wrong, the whole meaning and, the whole bill can change completely. So, once you have that deep understanding of medicine and the coding rules, the real work starts. This is where the coder puts on their detective hat and starts poring over the evidence, the patient's actual medical record. Their whole job is to read through what are often these really long, complicated notes from doctors, lab results, and surgical reports, all to find the who, what, where, when, and why that points them to exactly the right set of codes. Just look at this. This is a real operative report for a patient with a broken arm. It's just a wall of dense technical jargon. It looks pretty intimidating, right? But to a coder, this is a treasure map full of clues. So the coder goes through that report piece by piece and pulls out the key facts. They see the diagnosis, a compound fracture of the left humerus. Check. They see the main procedure, an open reduction with internal fixation. Got it. But then they also spot these critical little details, like the extensive muscle damage and the fact that the radial nerve was exposed. Every single one of those details points to its own specific, separate code. And, the story isn't always laid out in a neat surgical report. In this case, a coder is looking at the doctor's notes from an ER visit. They have to actually parse the patient's own words. I was loading gravel, lost his footing, fell approximately 4 feet and landed on a rock, to find the codes that describe not just the injury, but exactly how it happened. So why does all of this detective work matter so much? Because the impact of getting these codes right, or getting them wrong, is absolutely enormous. Sure, it makes sure the hospital and the doctors get paid correctly, but it goes so much deeper than that. This data is literally the lifeblood of our entire healthcare system. These codes are used to measure the quality of patient care, to track disease outbreaks like a new strain of the flu, and to figure out which hospitals get funding for things they desperately need. It's the foundation for medical research that leads to new cures. The stakes are just incredibly high.
So the next time you happen to see a medical bill, just remember what's hiding behind that single line item. It's not just some random number. It is the final product of this hidden language spoken by professionals with deep medical knowledge, a mastery of incredibly complex rules, and the sharp analytical mind of a detective.
It really makes you wonder, doesn't it? What other invisible jobs are out there, quietly translating the complexity of our world, forming the essential unseen backbone of everything we do every day?